Hey, this is Greg Downing with Texas Medicare Advisors. And yes, we are approaching the annual enrollment period for Medicare, which will start October 15th and go through December the 7th. And there are a lot of changes happening to the Medicare Advantage plans in 2026. And let me tell you what's happening. First off, you're going to see that you have fewer options and you're going to have reduced benefits. Now, as you'll recall, they used to give you lots of goodies like these flex cards and over-the-counter benefits and dental and blah, 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 which saved you money, which was good. But they're going to be taking back or scaling back what they're able to give you in 2026, so you're going to be spending a little bit more money or not having as much to spend. All right, now why is this happening? Well, what's the pullback on this? Well, it's mainly the Inflation Reduction Act, which, by the way, has very little to do with inflation and mainly agendas. One of the big agendas of the Biden administration was to improve prescription drug plans for seniors. And the main thing they were trying to do was keep people's out-of-pocket maximums down. So in 2025 came into play where your out-of-pocket maximum copays could not be more than $2,000 a year. And there are several other things. I'm not going to get into all that. But bottom line is the plan actually really helps about 20% of the population, and the other 80%, well, they end up having to pay for that. Now, why is that? Well, with prescription drug plans, Medicare makes the Medicare Advantage plans pay for a lot more than they used to. All right. And remember, Medicare Advantage plans get their money from Medicare to provide you benefits. So they only get so much money, and they're trying to figure out how to make a profit and provide you with an attractive plan. Well, an example of the change is Medicare, when people used to go in what's known as catastrophic coverage, Medicare would pay 80% of the cost of those prescriptions. Well, that's flipped now. And in 2026, Medicare only pays 20% versus 80%, and the Medicare Advantage plan has to pick up the other cost. But they didn't give them any additional money to do this. They just said, go do that. So the Advantage plans are trying to figure out how to continue to offer attractive plans while still making a profit. So this is a big shakeup year, in addition to last year was too, but even more things are happening this year. So that's what's driving these pulling back of some of these additional benefits. And of course, the cost of healthcare goes up, the cost of my homeowner's insurance goes up, inflation, everything is increasing in price. And I just wish it wouldn't, but that's what's going on. So what do we know right now? Today is September the 4th. Okay, so we know that United Healthcare is dropping its popular PPO plans in the Central Texas area. So they're going to be focusing more on HMO plans. Also, we know that Aetna is going to be dropping their PPO plan in Williamson County. They'll still have it in Travis County, but it won't be in Williamson County. Now, we know that Humana will have PPO plans available in 2026, but they are still not in network with Baylor Scott and White, so there's always a challenge somewhere. Also, now we cannot discuss any details of these plans until October 1st, and we must have you complete a scope of appointment, which gives us permission to help you before we can actually talk to you. It's a government compliance form we have to keep on file for 10 years. So this is what's going on. All the plans are having to figure out how to be profitable and still offer you a good product. So you're going to see all your plans are going to have a little more deductible cost, maybe not quite as much coverage on dental or vision, things like that. They're all cutting those back a little bit, so you got to just do a little shopping. All right? So the trends that we're seeing here is what? Well, there's a big push for people to be in HMOs, health maintenance organizations. Again, these are Single networks, you use your primary care provider. That's the person that you have to get a referral from to go see a specialist. And the concept behind an HMO, way back in the beginning, is that better outcomes for the patients through better management. And this allows for the insurance companies to manage their costs better, so they don't have people running all over the place getting tests without their knowledge for things that maybe are not necessary. Now, one good thing about, not that there's anything bad, but it's just what it is that if you're on an HMO, you will see that you actually have a little richer benefits, and you're going to have lower out-of-pocket costs. So that's the trade-off with moving from a PPO where you have a little more freedom, but you go to an HMO. You'll see when you do comparisons, your out-of-pocket maximums are less, and some of the copays are going to be less, and you might even have a little richer benefits. All right, so that's what's happening. Now, what I need you to do, if you'd like me to help you pick a plan for next year, is to complete the scope of appointment form. So wherever you're watching this, there's a link somewhere for you to click on that, and that's where you're going to update your information. Mainly what I need is your doctors, your prescriptions. If you've changed your address, you can put that in. If it's the same address, you can just skip that part. But that's, again, giving me permission. I've got to do this every year, even though you've asked me to. It has to be in writing. It's a compliance thing. All right. And then once I get that done, it's electronically submitted to me. I got it. And then starting October 1st, I can start talking to you about the details of each and every plan out there and then help you get signed up, but not until October the 15th. All right. No, in order to do all that, once you get that done, make sure and get on my schedule for a 30-minute phone call so we can review all this information. And then, like I said, beginning October 15th, we can pick you a new plan. Now, if your plan's being canceled and you don't do anything, you're going to just get kicked back to original Medicare, and that's all you're going to have. You won't have a drug plan. You won't have anything. So you need to pay attention, and also you're going to get your annual notice of change from your insurance carrier. You want to read that information and don't just throw it away. You're going to get a lot of stuff, but that's very important, your annual notice of change for your coming 2026. All right, just a brief introductory of what's going on. We will get through this like we always do. We appreciate you so much being a customer, and just be patient with us as we struggle through and get through another annual enrollment period, and you have a great day. All right, bye-bye.